very good afternoon to everyone. Thank you for joining us for our webinar today, focused on the important topic of working in partnership to tackle the challenge of digital inclusion, delivered to you by Public Sector Executive in partnership with Cantium Business Solutions. Public Sector Executive is always keen to deliver content which inspires innovation after the event is finished, and so this webinar will be available on demand via the website publicsectorexecutive.com. I am your host for today. I'm Claire Bell, Cabinet Member for Adult Social Care and Public Health at Kent County Council. My work covers a wide range of services providing social care and health services to the residents of Kent. I chair the Kent Health and Wellbeing Board, as well as the Kent Substance Misuse Alliance. I also sit on the Multiagency Kent and Medway Adult Safeguarding Board and the Integrated Care Partnership Board. The ICP is part of the Kent and Medway Integrated Care System, which became operational in July 2022 and is a partnership of NHS organisations and the Kent and Medway councils. We know that around 22% of the UK population lacks basic digital skills. And so today we'll be looking at how local authorities are addressing this and how we can work together better with the NHS to ensure that, as far as possible, everyone in society can benefit from the opportunities which the internet provides and which for most of us are an essential part of everyday life. We will hear first from our panel of experts, and afterwards there will be an opportunity for you to ask questions. To ask a question, please may I point you to the Q&A button on the bottom of your screen. If you want to ask a question of a particular speaker, please put the speaker's name at the start of your question. So let's welcome our panellists. We have Georgina Walton, who I know better as Gina Walton. Gina's the senior project manager for the innovation delivery team for adult social care and health at Kent County Council. We have Steve Whiting, the client director of Cantium Business Solutions, Carolyn Downs, chief executive of Brent Council, and Sam Lane-Rose, who is the digital lead for inclusion and capabilities in the strategy, policy, relationships and corporate assurance department at Kent County Council. We do like our long titles at the council. Thank you all for giving us your time today. So to set the scene, today's panellists will be answering questions about working in partnership to tackle digital inclusion. This partnership is often between local authorities and healthcare providers or as part of an integrated care system. We'll be looking at the barriers to health and social care integration, as well as some examples of how Kent County Council has been tackling digital inclusion through its public health team in partnership with Medway Council and through its Empower Care project team in partnership with several healthcare providers. Cantium are also on hand to provide their perspective and insight on how to approach digital inclusion projects and share their experience of working with councils and care providers in the digital inclusion space. So I would like to start by giving each panel member a minute or two to introduce themselves, starting with Gina. Gina, you are the Senior Project Manager for Innovation and Delivery at Kent County Council. Could you tell us a bit about yourself and your role?
Yes, thank you. And hello, everybody. So I'm Gina Walton. I'm a Senior Project Manager within the Innovation Delivery team in Adult Social Care, Kent County Council. And my portfolio of work tends to oversee more of the digital and innovation activity, which includes Empower Care. So Empower Care has been a 3-year project, which is an Interreg funded project. So that is a European funded project, which allows us to work with 13 organisations across the UK and countries in Europe. And the aim of that project has been to create resilient communities and reduce individual frailty and loneliness through digital solutions. So today I'll be able to talk more about how we've approached that project in terms of the equipment that we've provided in partnership with Cantium and also the support that we've put in place through that project and how we are taking that learning forward to inform our future approach for adult social care.
Thank you very much, Gina. Come next to Carolyn. Carolyn Downs, you're the Chief Executive of Brent Council, which achieved the prestigious Local Government Chronicle Council of the Year Award 2020 and was named London Borough of Culture too. Please tell us what these awards meant for you and your team.
So thank you very much for that, Claire. As said, I am the Chief Executive of the London Borough of Brent, which is the most diverse borough in the country, and is a borough of much opportunity and also sadly, a lot of poverty. Just really coming around, both of those awards obviously meant a lot to the authority and provided a huge bonus and an opportunity for us to work with communities. I do, however, lead for 8 chief executives in London for the integrated care system of North West London, which is the largest integrated care system in the country, covering a population of 2.5 million and one of the most diverse populations in the country as well. COVID hit North West London very, very badly indeed. We had a very high number of deaths, but particularly amongst the Black and Asian community. It also really massively exposed inequalities, health inequalities, and digital exclusion. So we've done a huge amount of work as local authorities in providing digital, even internet access and payments for internet throughout COVID, which we are now continuing as a means of ensuring that everybody has the same access to care, education, and other services through digital. Health inequalities, I have to say, is one of the most important things for our ICS to tackle. Thank you.
Thank you very much, Carolyn. Next to Sam Lane-Rose. Sam, you work as digital lead for inclusion and capabilities at Kent County Council, tackling digital exclusion and poverty in the county. Could you tell us what does that mean and what are the challenges that you face?
Thank you, Claire. So yeah, in terms of what that means, I look after digital access, digital connectivity, digital skills and engagement in the entirety of the council. We will sit within the policy and relationship side of the council. So most of our work is in partnership with those district and borough councils across the county. And we also work in collaboration with the NHS on a number of projects and obviously Gina as well. So we have a number of schemes and we have a number of projects that we run, one of which is the Digital Public Health Loaning Scheme, which Cantium is one of the suppliers for, along with another number of other projects, including digital hardware access scheme or a connectivity access scheme, and digital champions that are volunteers that links and interfaces with Empower Care, for example, and other projects elsewhere in the council and the communities.
Thank you very much, Sam. And finally, Steve Whiting. Steve, you're the Client Director at Cantium Business Solutions with, I believe, over 10 years experience in digital transformation, including the recent Kent and Medway Care Record project. Could you tell us about yourself and your experience of the digital transformation industry?
Indeed, thank you very much. Good afternoon, everybody. Yes, Steve Whiting, I'm Client Director at Cantium Business Solutions, and we for this project, we work really closely with the councils involved, Kent County Council and Medway, and some of the foundation trusts around designing what this solution needed to look like. So we put this together in collaboration with a number of organisations, and really that's all the way from designing that service through to procuring the devices and providing that end user support. And our role really in working alongside the council is to make sure that this technology enables and supports the agendas of these various groups, and our role has very much been supporting that and working closely with the councils.
Thank you very much. So we'll move on now. I just would say today is not just about us sitting here talking to you through our live question and answer function. We do encourage you as our audience to get involved and ask the questions you're keen to know the answers to. I will be trying to keep an eye on them throughout the proceedings, and as well as opening up the floor to you a little later on in the conversation. And finally, please feel free to share your thoughts and experiences today across social media using the hashtag PSE365. That's PSE365. So let's begin. I've got quite a list of questions here. I'll be starting with Carolyn, and may I just ask the panelists to keep your answers fairly concise if possible, so that we have time at the end for questions. So Carolyn, what is the biggest barrier, would you say, to health and social care integration?
So for myself, there are quite a few potential barriers. Just estates, co-location of staff being one, digital interoperability as well between health and social care, a genuine lack of funding, and workforce and recruitment issues, I think, are really, really difficult across both health and social care. If I had to name the single biggest barrier, I would actually say workforce, certainly in a London context. Our ability to attract and retain the right workforce, support the need of our communities, is extremely difficult. Our ability to pay the right amounts of money to fairly reward staff, and to have a culture which genuinely empowers staff to think beyond their immediate service areas and to respond to what are very complex, multifaceted health and care needs of our communities, I think are really great, really, really great. I will leave it at that, because I think there will be other things that other people say. I'm happy to come back on any points there.
Thank you, Carolyn. I think what you've said so far chimes very much with our experience in Kent as well. Could I go next to Steve? With those thoughts in mind, how did Cantium approach creating its digital inclusion service for Kent County Council, Medway Council, and Empower Care?
It was very much a partnership approach, making sure that we spoke to a wide range of people, and everyone was engaged in making sure that service design was correct, and designing of the service and really understanding the needs of the users was really critical in making sure that the project was successful. And that included actually running some pilots, developing a series of prototypes with different groups, families, vulnerable individuals, elderly, and kind of understanding that they've got very different needs, and so the service design was really important in making sure that this actually did meet the needs of the users.
Excellent, thank you, Steve. Gina, could you give us an example of how the devices have been used in KCC's Empower Care project?
Yeah, absolutely. So as Steve said, it was really important to understand what mattered to people, and particularly co-producing the approach and support. And people fed back that what we needed to put in place was the opportunity to be able to test before they brought solutions. So we looked at putting in place tablets and Alexas, because people fed back that they were some of the most suitable solutions. So tablets to enable people to connect with others to reduce social isolation, but also do online activities, but also using Alexas to help prompt with medication. Alexas were also programmed to help people with daily activities and living. So an example of that was around somebody who had autism and ADHD, as well as other medical conditions, and suffered greatly with anxiety and stress. So working with that person, they were able to program the Alexa to help that person on a daily basis to be able to manage that anxiety and undertake breathing exercises. So those solutions were very much informed by what people felt were most useful, and we were able to then support them through training to help build up their confidence in using those devices.
Thank you, Gina. So Sam, can you explain why you chose to gift your devices through the hardware access scheme rather than using a lending model?
So from a digital inclusion point of view, when I joined, there was already a loaning scheme that Cantium had was delivering with public health. So we looked at the other gaps in the market in terms of what was being offered in Kent, and we decided to take a kind of an access gifting model to residents, and that was one to kind of improve that kind of ability to provide a laptop that is theirs and they have that responsibility and that ownership over. It also means the liability is then theirs as well for the end user. But equally, that ethics of then potentially ending the scheme and having to take devices back and then make them digitally excluded again is reduced. What we've also seen is that it has improved the time and cost related to delivering that project from our side, and the security and the risk factor from an organisation perspective. However, it doesn't solve all the problems. There is a place for loaning, but I think that for a large portion of our service users, that was beneficial for them to have a gifted laptop.
Okay, thank you, Sam. Back to you, Gina. How has KCC's Empower Care device loan scheme helped people who draw on care and support?
Yes, so we helped over 81 people during this project, and some of that has been through one-to-one training sessions. So people that are supported by adult social care, when we have been discussing with them around how technology and digital could be used to support them to remain independent, the feedback is that the technology in itself is the simple part. It's more about how people have then used the technologies and have the confidence to use them, to support them to live independently as part of their day-to-day living. So what we were able to do was, through a digital ambassador scheme, set up training, who then worked with people that draw on care and support to help build up their confidence and awareness of technology and how it can be used to support them in their daily lives. And feedback from people around how they've used the scheme to enable them to live independently has been around joining group chats and gaining confidence, which has reduced social isolation and fear of technology, which has meant that they've had confidence and been able to help others. That the skills and training and making people aware of the benefits of using digital technology and to stay connected has a real impact on that person and being able to allow them to connect with family and friends. Someone fed back that they'd been shielding during COVID, and a lot of their time was spent with health appointments. So being able to access both loan devices, but also training through digital ambassadors who showed this person about online security and aspects of keeping up to date and making sure that security is considered when using the digital solutions, that really helped that person during that very difficult time to be able to connect with others. And people fed back that that they feel better, that they feel part of a community again, removing the fear, and that this has really helped build up their confidence, and that they now feel that they're able to look at other digital tools to help them in their day-to-day living.
Excellent, thank you very much. With that in mind, Karen, could you say something about how you how the two different cultures at local government organisations and healthcare providers can, if you like, learn to respect the culture of the other?
Yeah, well, just listening to colleagues in terms of the way that you've tackled social isolation, mental health issues, and actually getting people used to technology, I think is a perfect example of how the two completely different cultures can work together in a way that actually achieves specific outcomes for individuals. So I actually think the more we refer to residents, the health service refer to patients, but a different language completely. But the more that we put what is right for the individual person to whom we're providing a collective service, and we put their needs entirely as the focus of what we are trying to do and deliver, then I think that is the way for us to actually blend our cultures together much more collaboratively, so that we're actually working on a person's specific needs, whether we're actually meeting those needs through a care package, whether that's got a digital element to it or not, rather than constantly disagreeing about eligibility criteria, funding and accountabilities. All we're doing is caring about the needs of the individual person that we are serving. I personally think that is the way that we learn to respect each other's strengths and to combine together to provide a better service.
Thank you very much for that. And Steve, thinking of how local government and healthcare providers learn to work together, what advice do you have for councils and healthcare providers looking to set up device-based digital inclusion projects?
I think, as I've already mentioned, that multi-agency collaboration is really key to this, and spending time working together, looking at designing the service to make sure that the solution that's put in place is actually meeting the needs of the users. And the users have got very different needs depending on what group they're from and what their particular usage is. So whether that be a difference in the type of device that they need, whether that's a tablet, laptop, mobile, etc., what kind of access they've got to different what applications they need access to. So really making sure that you do work together with the users through your delivery teams, because they understand the service it's providing to the users, and they will understand how best to deliver it and provide that service digitally. But it really is that time up front that works with users to make sure you really get an understanding of how this is going to work.
Thanks, Steve. And I think that person-centered approach is proving to be quite a key theme throughout all of this. That's the sort of message I'm getting from it, certainly. Sam, how has collaborating with third-party organisations like Cantium and also healthcare providers helped to improve and strengthen your digital inclusion work?
Yeah, absolutely. So with working through Cantium, obviously Cantium work with not only Kent County Council but other providers, learning lessons and sharing best practice has been really helpful. Equally with the health providers, health care providers, listening to their feedback, consulting with them, and being able to co-produce and co-design, schemes and projects that will have an impact has been really useful for us. And bringing in that wider partnership and looking now more nationally. So we've been working with Essex County Council and Manchester and Leeds on different learning lessons from them, and kind of sharing that best practice here, as well as other regional schemes like the STEM Ambassador Scheme and other things like that. So it has been really helpful, and it has had an impact on the way we deliver and the support we can deliver for the residents and those patients. So I think it's been hugely beneficial.
Excellent, thank you. Gina, how did you encourage the adult social care workforce to utilise the Empower Care loan scheme?
So we introduced technology facilitators. So these were roles that we created internally within Kent County Council, recognising that there is a real culture change required to embrace digital first, and also being aware of what is available to allow people to live independently, but also what support is needed to help people use those digital solutions effectively. So the technology facilitator role was created, and that role very much works within the with the internal workforce, raising the profile of digital, showcasing different solutions and how those solutions can be utilised, but then also going out and working with people that draw on care and support to help showcase those technologies and help them consider how they can be used, but also what support they may need to have in place to be able to use those solutions effectively. But also considering other factors such as the digital infrastructure. So we worked with Sam to think about if we're going into someone's home and thinking about some digital solutions, what infrastructure is in place? Have they got Wi-Fi? And if not, what support may they need to have Wi-Fi put in place? So those technology facilitators would very much complete a technology assessment, looking at what the care and support needs were for that person, and working with that person to think about how digital could be used to enable them to live independently, but then making the links with other programs to ensure that that person has access to the right solutions and the right support.
Thank you, Gina. I mean, do you have anything to add to that as to why you think the Empower Care device loan scheme was successful?
Yes, so it was successful for many reasons. One, because we had that technology facilitator role working very closely with our workforce, raising the profile of the project and what was available. The fact that there was the loan scheme so that people could try before they purchased, But as I mentioned earlier, technology is the easy part, having those solutions is the easy part. It was really about the support that we put in place to enable people to feel confident with the solution. So that could have been through one-to-one training or through group training from the Digital Ambassadors, which is a scheme that we also created as part of this project and is now being sustained by the programme of work within Sam's team. But having that dedicated support to help people think about how they want to use a tablet and train and build their confidence up. But also in terms of the loan scheme, we've already talked a lot about person-centred approach and co-designing the way in which people can access those solutions and how they're then used, and making that process really easy. So not only easy for the workforce to access that loan scheme, but also for people that draw on care and support. So looking at how is the equipment delivered to the person, making sure it's done timely. When that equipment arrives at that person's home, how is it set up? How are they supported to set up the equipment? So we worked through all of that to ensure that that was all considered and that the right support was also put in place so that people felt that they felt very supported throughout their journey and knew where to go to if they had any issues, including technical issues. And that was also the support that was provided by Cantium.
Okay, thank you very much. Sam, how did you approach the digital champion network model for Kent? And could you say what makes your network unique compared to others around the country?
So we approached the network model based on learnings from others in terms of kind of recruiting volunteers, not just digital champions, but any kind of volunteer. And obviously when we created the network, it was kind of as we were coming out of the pandemic and recovering. So a unique kind of set of circumstances around people's time and kind of motivations at that point. So we took the approach that we wanted to kind of attract as many volunteers as we could possibly, because anyone could help at least someone, and kind of focus that on with their colleagues, friends, family in their kind of support that they did initially. So that's kind of the approach we took. We had a target of 300 volunteer champions by the end of the calendar year, which is December 2022, and quite proud to say that we've got 475 champions onboarded, and that was as of the end of September. So obviously we've got more room to gain more in the next few coming months. What that has enabled us to do is where people thought there was a commitment, rather than having a commitment of an hour, 2 hours a week on certain days and times, it was very much flexible and fluid for that individual, and it was bespoke to that individual wanting to kind of volunteer. What that has meant is that people that may not have had the time or foreseen having the time to volunteer, even a week or every week or things like that, they would have been put off by joining and that network. They haven't joined, and they have been actively engaged in delivering sessions across the entire county in partnership with other organisations, and strengthening their own kind of digital skills and stuff within their own settings, whether that's another small enterprise business within the county, or whether that is in a health organisation like an NHS hospital trust. So that's what we've done kind of differently in terms of how we approached it, and obviously we've had quite good success with that. We've been able to speak, or we are speaking at a national conference in November around our model, and this year we were also nominated for a data and marketing award for the campaign that we did in July to promote the Digital Champion Network. So we're quite proud of that.
Oh, rightly so. Did you encounter any challenges you weren't expecting since you started this work? And could I also ask what would your advice be to other councils looking to set up similar digital inclusion projects?
Yes, so in terms of the challenges we weren't expecting, I think the majority of the challenges were the amount of need. So those that need to be referred in for hardware. So that kind of was a challenge in itself, trying to make sure that we could get on top and continue to kind of make those referrals and deliver those laptops or devices. For the Digital Champions, it was in particular a very kind of once we've done the kind of campaign to recruit those champions, there was loads that wanted to get involved, more than we thought there would be. And the process itself was a bit clunky in terms of administering that, but we've streamlined it, made it a bit more self-sufficient and more manageable, so we were able to do that quickly. And what we've learned from everything we've done is, as much as we can, let's try and automate it and use the tools we've got. Most councils will have a Microsoft Office license, which has Microsoft Flows on how to automate. We can use those to our advantage, so that when we're dealing with referrals that come in, we can automate some of that stuff, so we don't need heavy reliance on staffing, especially if staffing is an issue, workforce is an issue. So for us, it's mainly been that. In terms of the challenges we weren't expecting, some issues, some slight issues depending on the projects we're doing. It could be legislative issues, especially around the broadband sector, because obviously it's not the same as the other utilities. So, but other than that, that's kind of those challenges. In terms of what my advice would be to local councils, other local councils looking to do it, it is about partnerships. It is about collaborative working. And it is looking about the holistic approach, because digital exclusion itself it is an issue on its own, but actually there are other social factors around it. So it could be financial pressures, it could be health or impairment issues that stop them being included, and that means that they need a tailored approach to how they use that technology, as Gina's team kind of knows and does day in, day out. So there are other social issues, and about looking at those other social issues and having a holistic approach to tackle that. So that's what we do as well. So especially across the county where financial, because we sit in the financial hardship team, if there's financial hardship, we will support with citizens advice referrals, or fund some citizens advice work for that debt problems as well. So that's kind of what we've done. So that's my advice, really.
Very useful advice too. Thank you, Sam. Steve, what is your biggest takeaway from working with councils in the digital inclusion space?
I think it links back to what Sam was just saying, really. I think the big thing that we took away was that just one size doesn't fit all. Depending on the group that we're talking about, whether that's elderly, vulnerable, drug, alcohol service users, or young parents, we need to look at the approach that's suitable for each of those user groups in a different way, and make sure that time is spent in making sure that the needs of those groups are understood. And I think, as one or two people have said, in terms of the equipment, in terms of the delivery of that equipment, but particularly in terms of training and digital awareness, that's becoming more and more important. And the equipment itself and the connectivity, yes, is one thing, but it's not enough on its own. You need to make sure that people have actually got the right level of digital skills to be able to use and access what they need to access in the best way possible.
Thank you very much for that. Now, I'm aware, I've had a word in my ear that we have some questions, and I would like to just turn to those, but I'm not actually seeing them. I don't know if anyone on the call can just point me in the right direction as to where those questions are.
So I found the questions.
Let me ask your question. Sorry, I'm looking in entirely the wrong place. If you just bear with me. So, right, I'll just pick out a few of these. So Gail Harvey has asked, how did you engage with residents who are digitally excluded? Few abbreviations here I'm not familiar with. How did you motivate them to take up the offers and gain their trust? Would anyone like to take that question?
I'm happy to go first, and maybe Sam would like to add to it because our projects are quite similar. Is that okay, Sam?
Absolutely fine.
Yeah. Okay. So in terms of working with people, mainly the people that were part of our project were people known to adult social care. However, we did also work with communities through our digital ambassadors. So we went out into communities to identify people that were not known to adult social care, and try and raise the profile of the project within communities, and working with community centres and other places where we were able to host information sessions. So we were working with other community connectors such as navigators and also community wardens to identify people that might benefit from having this support. And in terms of motivation, the motivation was that it was a loan scheme, so people were able, that there was no financial commitment, and also that we were able to put the support in place to build up their confidence. So that was the motivation for many, was that they were able to try before they brought any products, if they wanted to go on and purchase a tablet for themselves, but also that support was available.
Thank you. Anyone like to add to that?
I'll just add, Claire, I think for Gail's for the more generic stuff as well, what we've done in terms of motivating residents is it's very similar to Gina in terms of the partners we work with, but sometimes it's, although we want to go and support them accessing council services online, or it might be the NHS app or other things, GP surgeries and repeat prescriptions, sometimes it's not they don't want to be online and they might not have that willingness or motivation at all. But sometimes when you listen to the other issues they have, and one of those is they want to go down to the shop, for example, because they like that experience, but they hate carrying all the heavy stuff to their house back home or on the bus or wherever it is. And then having that conversation saying, well, actually, why don't you just get the bulky stuff online? But you still pop to the shop for your bread and milk and the bits that are lighter, and that has then a way in, and then they start using it for that, and then they then start going, oh, actually I can use it for this, and actually it's easier, and it's having that, what is the hook for them to be on online and digitally included, because not everyone that's digitally excluded is digitally excluded without wanting to be. Some of them do want to be digitally excluded and not interested, and that is a particular challenge for us, and it's kind of looking at turning on its head and going, well, actually what might work for them to be included.
Thank you very much. And just a question that's come up relating to the training for digital ambassadors, I think a very important issue. How do you ensure safeguarding, considering that the people that they'll be supporting are vulnerable people?
So I think for us, in terms of safeguarding, we follow our policies and procedures generally, and the best practice nationally. They go through and conduct training, very extensive training. We also have staff on hand if there is an issue. Both the resident knows that they can report any issues they have, as well as the digital champion if they've got a safeguarding concern. And we have a front door open door policy that enables us to do that quite systematically, and everyone's made aware. And not only is it done as part of the induction, but we continue to kind of share that message as an important thing going throughout the whole life cycle of that digital champion, as well as that support we're giving to the resident. And at touch points, we will still contact, if they don't want to come to us, we'll still contact them regularly to check in, see how everything's doing for the resident and for the digital champion. So those systems and that process is in place, embedded to maximise and ensure everyone's safe across the piece.
Okay, thank you very much for that. I can see there are small questions. I'll come back to those maybe a bit later, but I'd just like to return to the panellists for now and go on back to Carolyn. Just returning to what we were hearing just earlier about the advice for other councils. Carolyn, how do you think the integrated care systems can make a difference with digital inclusion?
So I think they can make a massive difference. Actually, I think that you can actually make a greater difference, certainly in the London context. I'd be interested to hear about Kent and Medway. I think we can make the greatest distance at a place-based level, so at a borough-based level. For me, is where we will be able to make the greatest difference, where the local authority can have the greatest impact as well in terms of providing support to residents within that place and putting the digital equipment in place. So I do think the integrated care system, by actually operating strategically and indeed operationally at the very local level will be able to combine resource and combine expertise to actually join up. We actually did a huge amount of joining up during COVID because we had to. So I do think health and social care work together very well in a crisis, because we have to, and we're able to bend the rules and flex and do things a little bit more, which are more locally centred. The more locally centred, the more place-based our initiatives will be. I think the more we'll be able to join up, whether that be in terms of digital, workforce, or indeed the care that we provide.
Okay, thank you, Carolyn. And just further to that, what would you say would be the most impactful thing that the ICS could do to improve health outcomes for people in your borough in particular?
Well, it's very interesting. I personally think there should be as much focus from the NHS as stopping people from getting into hospital, and all the work that you've done and explained today in Kent around digital inclusion, if I can use that, all the work you've done that about stopping people from getting into hospital should be as great a focus as there is about getting people out of hospital. So we should definitely be constantly preventing primary care, improving public health, improving pharmacy support as well, and improving all the work that we do as local authorities to make sure the wider determinants of health are included to make people healthier in the communities they live in. So that's what I would concentrate on.
Okay, thank you very much for that. Sam, as we begin to look at the future of digital inclusion, reflecting on the first year of your digital inclusion work, what key milestones do you think you have achieved?
I think what we've achieved is better and kind of deepens relationships and strengthens those ties, both internally and externally, with stakeholders and partners. I mean, we've smashed most of the targets that we set ourselves and that were challengingly set as well for us. In terms of what we're also looking to do for the next going forward is compare what our digital exclusion reports were in June 2021 and to what they are now, and that work's being undertaken as we speak. In terms of the other key milestones and achievements we've made is the development of our own team and the wider teams across the council in raising that profile of digital inclusion, particularly as local authorities, healthcare and public sector bodies will be going through a period of transformation digitally as they deliver services more online where they can. Yeah, that's kind of, I think, mainly the reflections that I have for the first year.
Yeah, thank you very much. And again, just sticking with the future now, Gina, what are your plans for the future, and how do you sustain and continue the Empower Care project?
Yep, so the Empower Care project will come to an end in March 23, which is when it's funded up until, and it is a fully funded evaluation led by the Christchurch University. But we are taking learning from that project, which is informing our future thinking, which is aligned to our adult social care strategy, making a difference every day, around our future aspiration for technology-enabled care, and how we're looking to procure a county-wide contract next year to support people, but also taking learning from other work, such as the award-winning video care phone, Cara. So we've taken our learning from different digital projects and also the learning from Empower Care to really think about what we want from the future in terms of technology-enabled care contract, but also the support that needs to be put in place for that, and how we want to increase the number of technology facilitators working in adult social care. So at the moment we have 2, which were funded as part of this Empower Care project, but we want to look to increase the number working within health and social care. So we've been sharing the learning with health colleagues to really think about how we can have this as a more integrated project in the future, and looking at opportunities around falls prevention, but also around how we work with the care sector to support digital literacy within the care sector.
Okay, thank you. Very interesting. And Steve, with your insight from across the sector, what does the future look like from your point of view?
From Cantim's point of view, I think we've learnt a lot from working on this project, to the extent that obviously, you know, we've looked to rebuild and fine tune, so that as we work and talk to other organisations interested in doing this, then we can bring that experience and understanding to bear, that hopefully makes it a much easier journey for them. And certainly from our perspective, the access to our services, accessibility and security is something that is very much at the forefront of our thinking as we develop and look to move forward. So I think whilst there's a huge amount that's been done and it's been very successful, I don't think any of us are clear that we are already there, and there isn't still a lot of work to do on this.
Okay, excellent. So I'm going to just those are sort of questions I wanted to ask the panelists. I'm going to go back to the questions from the audience, and fortunately I have found the full screen button now on so that I can actually read your questions slightly better. So I'm just going to run through them because I think they're all good questions and we should have time, I think, to fit them all in. So I'll just start with how do you evaluate the benefit of your programs? Who would like to start on that one?
I'm happy to go first. So, as I mentioned, the Empower Care project is actually it's a research project. So we actually have the Christchurch University that are working with us on this, measuring the impact. And there's different elements that are being looked at: outcomes for people, improved quality of life. So they're key measures around what's the experience been in being supported and accessing digital solutions, and then what impact has that had on their lives. So there's those measures, but then also measures around workforce. So workforce in terms of increased awareness and confidence in promoting digital to people. So we're looking at those two key areas. And there's different measures that are within that for us to look at. And we're going to gather all that information as part of a full evaluation report that will be available in March 23.
Thank you very much for that, Gina. And I think, yes, that answers the next question about the evaluation report. Or is there a blog that can be shared with adult social care colleagues? I've been asked as well.
Yes, yeah. So we've got a Twitter feed, so people can keep up to date on what's happening with the Empower Care project. We actually also have an annual event later this year, which people are absolutely invited able to join, and I'm happy to share that information because that will share the wider learning so far from the Empower Care project.
Okay, thank you very much. So I'll keep on through the questions, and please do dip in, panelists. I can't actually see you while I'm looking at the questions, so please just if you can contribute, just say so. So has there been any consideration to being able to signpost any of the individuals onto priority service register listings where they could receive additional support and recognition?
I don't know, Sam, is that something?
It's not something we've looked at already, but there's something that we can take away from today and have a look at, definitely.
So in terms of the Empower Care project, our digital ambassadors started with us many years ago, and as I say, they've now moved into the Digital Kent programme, and Sam's really talked about the comprehensive training and support that they are offered as digital ambassadors. But as part of the support offer, when they were working through the Empower Care project, was looking at the support that people may need and being able to connect and signpost them, and looking at tools such as the Connect to Support platform, which is an adult social care platform that provides information, advice and guidance. So digital ambassadors were able to go through that with people that they were working with so that people knew where they would be able to access information and connect with services.
Okay, thank you very much. Next question. Digital first requires ongoing and increasing budgets for supplying the right technology, but also when technology companies update hardware or software, hardware can become obsolete after just a few years. How do we tackle this with tech companies and bearing in mind our drive towards net zero, not wanting to fill more landfills or recycling sites?
I think I can answer that if that's all right, Claire. So in terms of how we tackle the tech companies, that I think that's broader than just us and me. But in terms of how do we support our drive for net zero and for not going to landfill and recycling sites, what we are doing in Kent is we're developing a recycle scheme that enables us to turn those laptops into remanufactured devices, whether it's parts or whether it's in full. And therefore it goes through a circular economy in that sense. All of the laptops we've been gifting and providing, and most of the devices that generally from Digital Kent perspective has been remanufactured devices, so they've had a net zero kind of impact, and we've got a certification from our supplier to kind of say the environmental impact we've had with buying those devices. And what they've done has also been a lot cheaper. So when you're buying new technology, sometimes it is more expensive because obviously it's the latest tech. But if you can get remanufactured, it's better than new sometimes in terms of the specification. It might have an older kind of look, but actually the technology within that laptop or within that device is much more superior than what it would have been if it was a brand new device sitting on a shelf. So that's what we've done. We've taken a model where we've gone, we'll buy remanufactured rather than new. And also, as we know that we've gifted a load of laptops out to people, and also there's other laptops and other devices out there in the community that are probably sitting in drawers. I mean, some of us probably have drawers full of old mobile phones that we've kept because we think, oh, we might need a spare just in case this one breaks. We can then donate those and get value out of those to then kind of pay that forward to other digitally excluded people. So that's kind of what we've done from our perspective. It doesn't fix the whole problem, but it does hopefully alleviate some of the problem.
And can I just add to that, Claire, please, that we are very much looking at being outcome focused in regards to technology. So instead of going away and purchasing a load of tech that sits in a cupboard, that we want to work with individuals to understand what matters to them and what they need to be able to live independently, and therefore then match them up to the solutions. Which ensures that we can hopefully remain innovative and that we are not then, as I say, filling a cupboard full of products that then become very dated. And that is then clearly set out in our future requirements and specification that we have with tech providers, and also ensuring that our contracts are innovative and that there is a real focus around that innovation and ongoing innovation.
Thank you very much. And then there are a couple of questions which I'm going to put together because they're sort of connected. Did we say that digital champions are used to train social care staff, and do the digital facilitators champions have a social work background?
Okay, so our technology facilitators do. So one of them's an OT, which has been very beneficial, but by having that background has meant that they understand adult social care. In terms of the digital champions supporting people in terms of the care sector workforce, they've been very much focused around people, particularly those that draw on care and support. We have had a separate project which has supported the care sector workforce and looking at digital literacy, which I'm happy to share information further outside of this.
Excellent, thank you, Gina. The question about privacy. How are privacy concerns addressed using devices such as Alexa, where they privacy settings personalised for each person?
So from our perspective, in terms of the privacy and any devices that we provide, yes, they are tailored to the individual, and they have full control over what is shared, what isn't shared, and equally the same for anything in terms of the data and the information they share with the council. Again, we have very strong privacy notices and data protection impact assessments. So generally, everything is down to that user, what they require, and if they don't like that, then and it's something that is a functional requirement. That means that if they didn't want to consent to that, it doesn't work, then we'll have to look at other alternatives for that individual. But generally, yes, they have that full control.
Okay, thank you very much. Question on the team size required to start and grow a digital inclusion strategy.
I think, well, it's a very interesting point around what the team size. It depends on your organisation. It depends on how complex and how your organisation is structured. I'm personally happy to kind of explain maybe offline to that individual around kind of looking, understanding what your context is and giving some advice. I mean, we've embarked on our digital inclusion strategy, and we have, in terms of the delivery team, we have a delivery team of around 6 people across the county. In terms of project team, we have about 2 or 3, and we have some others that work on the strategy side and policy side. So we have a kind of a varied team, but we also support other councils and other local authorities. So we've been providing support to Medway Council, for example, and Essex. So those are, yeah, it depends on your needs and your requirements, but and what the context is you're operating in. But happy to help out the side of this if you would like.
And just to add to that, we started with 2 technology facilitators, which I say is now looking to increase, and also we had around 17 digital champions trained up at the start of the project. So quite a small team to start with, which is now looking to increase in size.
Excellent, thank you. We've just got a couple of minutes left, so perhaps just time to fit in 1 or 2 more questions. Specifically on working with people with learning disability, has there people who have perhaps struggled to use digital during the pandemic and still do? How have you worked with charities in your area supporting this key group, and has your approach changed in any way?
Sorry, Gina, I think you might...
Go ahead, please.
So in terms of how we operate with and work with charities, we've been working with the district councils as well as their charities. They have a lot stronger links. So we've been providing funding to the district councils, and they've provided funding to other projects. So, for example, the Pyramid Project in Swale, we've also provided some money to and funding to Citizens of Ice. And then we've also worked with our Kent Community Foundation body to gift out some funding through our grant application process that was match funded by their donors as well. So we've had a kind of that approach to work with our charities, and equally they are also on our steering group to help direct what our projects and schemes are like, so that they obviously know their service users.
And just to add to that, as part of our, when we trained the digital ambassadors, we thought about the groups of people that we would be working with and making sure that the training took that into account, to think about different ways of supporting people and different learning styles, but also how to communicate and support with people with different needs and support requirements. So we built that into the training programme for the digital ambassadors, and also worked with learning disability services as well to think about where people needed support in communities.
Excellent. Finally, I'd just like to mention the poll, which has been going on throughout the session. And I'm going to have to squint at this a little bit, so bear with me. I'll just read out the results. I assume that the audience aren't able to see these. So 2 questions. First one, which of the below areas does your organisation prioritise the most with its digital inclusion projects? And the response was 85% digital skills, 15% connectivity, and 0% accessibility. And there was also, I noticed, a comment in the chat that it was difficult to answer that question because it was equal focus on all in that case. And then, does your organisation engage with suppliers to help identify your requirements and design your service before going to tender or purchasing? And the result there was 45% yes, 27% no, and 27% not sure. Okay, so we're just about out of time. I would just like to say thank you to everyone who's taken time out to join us today. Thank you to our excellent panellists and to our audience for some really good questions. I hope you found the session helpful. As I said, the webinar will be available on demand via the Public Sector Executive website, so please do share this with your colleagues. And finally, from me and from everyone at PSE 365, thank you all again, and have a great rest of the day. Thank you.